So now the next surgery is going to be smile. Dr. Gaurav Luthra will be operating on a 28 years old gentleman who came to us seeking for LVC, and he had no history of contact lens use and stable refraction. He's been accepting -3 spherical and -0.25 cylindrical at 170 degrees axis 6 in right eye, and -2.75 spherical and -0.5 cylindrical at 165 axis, improving to 6 in left eye. These are the pentacam maps I wanted to show, and there are no outliers or red flag signs in both eyes. And even bad maps appears normal, except for mild superior steepening in the right eye. Eye trace Shang analysis of both eyes did not show any significant internal and corneal aberrations, and OCT epithelial maps are pristine with 535 microns in right eye and 540 microns corneal thickness in the left eye, and both were pristine and normal. Over to Dr. Gaurav Luthra.
Dr. Tulsi, am I audible, sir, in the hall? Am I audible?
Yeah, very well.
Great. So I don't know if you can see me, but I'm all set.
We can see the.
I'm all set. I have this young gentleman.
Visible.
Thank you so much. I have this young gentleman. I've kept everything ready for you. We have fed all the data. I'm not going to show you all the data because you must have seen it in the previous cases. I'm going to first make sure that the tear film is clear of all the debris. And so we've been doing smile for almost 5-6 years now, and I found that almost 60 to 70% of our volume is now smile, even though I still do a lot of contura, LASIK and surface ablations and trans-PRK. But somehow smile has so much more peace of mind for the patient and the surgeon that now much of our practice has shifted to smile, because there is no flap and the recuperation is very fast. The precautions for the patient are almost minimal. From next day they can almost do everything. After 24 hours, they can actually go for drives, take a shower, and even go for a trek if they want to. Not that we encourage them. So first, most important thing here is that I'm drying off all the extra fluid from the conjunctiva. I hope you have the microscope feed, sir.
Yeah, we have, but the centration is not okay. I mean, we are only seeing, it's slightly decentered superiorly.
Okay, so I'll set it right for you. Okay,
so
important thing is that the tear film has to be very, very good. I mean, the tear film has to be clean. The cornea has to be wet, but the sclera has to be dry. The conjunctiva has to be relatively dry. So that's what I was doing so far. And now we are all set. So we are going to move this bed a little down, and the bed slides down so that we can dock the patient. आपको लाइट में देखते रहना है और आपको छोटी सी ग्रीन लाइट दिखेगी. मेरी कुर्सी डाउन करो थोड़ी सी, बस. आपको ऊपर छोटी सी ग्रीन लाइट दिखेगी, वो ब्लिंक करती रहेगी. आपको उसके सेंटर में देखना है, हिलना नहीं है. मैं 20 तक का काउंटिंग करूंगा. 20 में से 10 तक आपको ग्रीन लाइट दिखेगी, और 10 के बाद 20 तक ग्रीन लाइट ब्लर हो जाएगी. जब ग्रीन लाइट ब्लर हो जाएगी तो आपको रिलैक्स रहना है, बिल्कुल हिलना नहीं है, और स्ट्रेट सेंटर में ही देखते रहना है. ठीक है, अब आप ग्रीन लाइट को देखते रहिए. मैं 20 तक काउंट कर रहा हूँ. यू हैव टू रिलैक्स एंड नॉट मेक एनी मूवमेंट्स नाउ. 1 2 3 4 5 6 7 8 9 10, and now the green light will become a little blurred. Remain relaxed, keep looking up, keep both eyes open. 11 12 13 14 15 16 17 18 19 20, and we are done. Very nice. So first step is over now. So this step is over, and now I'm going to do a dissection. And patients are very comfortable throughout, and the fixation is very good because they can see the green light, so they can fixate, and that's why the smile ablations are very well centered on the visual axis as compared to our lasers, which basically center onto the pupil, because it's pupil tracking that centers it, except for the topo-guided treatments. So I do a lot of topo-guided treatments as well with the Contura system and using Faucet's, but those are basically restricted to the high astigmatism and high aberrations. But for most of our myopes and with small cylinders of 1 or 2 diopters, this works really well. So I'm going to first dissect the deeper plane, and this is the deeper plane which has been dissected. And then I'm going to dissect the superficial plane, which is the cap. And I've created both the planes, and I've seen that they don't meet. So I've gone in 2 different planes and seen that they don't meet with each other. So I'm sure that the 2 planes are separate, and now I'll go to the superficial plane and dissect the cap. आप light को देखते रहिए please, and relax. So patients are very comfortable, and I don't need to stabilize the globe. Somehow I've learned from day one that I don't touch the globe because it's painful to the patient. Only in extreme situations would I try to touch the conjunctiva. Even with my cataract surgery, I don't touch the globe or the conjunctiva at any point, so that patients under topical anesthesia are very comfortable. So now I've dissected the deeper plane, and you can see that the lenticule is almost separated completely. Sister hydro expression करेंगे. So I have separated it almost completely, and you can see that the lenticule is attached only at one point. So I devised a technique of hydro explantation, just like SICS, where you do a hydro expression, and you can see here that I'll go inside and put a gush of fluid, and the lenticule, if it is fully dissected, will come out, and if it is not, most of it will come out, and it becomes very easy. See, now I know where it is attached. So this is a technique which I devised with the hydro expression, and now I know where it is attached, and I just have to tug on it, and the lenticule comes out. So this is the lenticule, and it's freely dissected. And now I just have to irrigate the pocket once to make sure. Many people, many surgeons don't like to do this particular step, but I feel that it just flushes out if there's any debris inside, and then just one stroke. And these patients are very comfortable right from day one. So there goes, the surgery is over and it's gone off very well. आपका बहुत अच्छा हो गया केस. So any questions I'll be happy to answer before we move on to Dr. Pandav. Dr. Amrita, can you find out if Dr.
Just
Pandav is ready?
mesmerizing, I would say. I think your Gaurav, your technique of hydro removal of the lenticule is very nice.
Thank you, thank you.
Because most of the people do manual removal of the lenticule.
Yes, so I don't go inside the eye because when you do a manual removal with the forceps, the risk of doing a cap tear is very high. So I don't like to do that at all. And this hydro expression is very controlled and atraumatic. And also, if the lenticule is still attached somewhere, you can identify it very easily. So then it becomes very easy for us to, just tug on it. And most of it has come out, and it's just like, a small area which is attached, and then you can just pull on it and it comes out. So the second eye I'm not going to show you unless Dr. Pandav is not ready. If he is not ready, I will continue to show till sir takes over from me, because he was just scrubbing and getting the patient ready.
We have the feed from the 3D OT, so and we can see the eye,
Great.
prepped eye. So I think they are ready.
Great. So you can transfer the transmission to the 3D OT now. I'm good with this. I'm doing the second eye without transmission. Okay.
Dr. Neelam, can you start the session on your side?
Are you comfortable? आप ठीक है ना? बहुत अच्छा हो रहा है. अब हम second eye कर रहे हैं.